Yeah, 2-0. Last call taken care of.
Are you on your way back up to the hospital?
Yes.
I've got a very interesting patient for you that technically, if he'd come in here unconscious, he would have been declared as dead.
Oh shit. I'm on my way.
Okay.
I still haven't got fuel for the ambulance. At least the light's not on, I suppose. It's the main thing. There we go. Right.
Do you know how poorly you are? Pain would go away? Really?
Yeah. You know, adrenaline rush. Maybe. Who knows?
Probably a stupid question with your skelly system, but how much pain are you in?
I mean, it's not too bad, like in terms of pain wise, but yeah, there's a lot of issues with me.
Jeepers, you really are sick.
Yeah, he's very, 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 very poorly. Even though his heart rate's telling us it's 100, he's extremely poorly.
Yeah, sir.
He's probably near enough, broken every bone in his body, pretty much.
Sir, you have to count yourself very lucky.
Yeah.
How come you didn't phone for an ambulance?
I don't know. I guess it was just there was a tsunami hitting, and I had to get to safety. There was no time to call an ambulance.
How come you didn't phone for one after tsunami?
Well, I had only just gotten back from shelter, so yeah.
Right.
Sir, do you mind if
sooner than later?
I asked how it happened?
Yeah, well, one day I was playing basketball, and then the next I fell off a ladder. Very sad.
Right. Right. You know that I'm a doctor, obviously.
Yes.
I wouldn't be happy and I don't think George here would be very happy to just stick some braces on you and patch you up and away you go with that.
Definitely not. This is more serious.
We would be risking our jobs if we just put a few braces on you and sent you on your way. With the severity of some of your injuries, we would be risking our jobs, put it that way.
Yeah. I agree. I think the patient has to stay in.
What we need to do, George, is we need to take him down and get an x-ray. Just to double check, and as I'll explain to the patient while we're here, it's not because I'm forcing you to have an x-ray, it's not that. It's purely, what's the word? I can't think of the word. It's to rule anything out to make sure there's no broken bones or anything.
I think I may have broken my pinky toe.
I'm pretty certain you've broken something.
Yeah.
I'm 100% on that, dude.
Also, with all the broken bones, we have to check as well in case there's internal bleeding.
And that's another thing I was about to... thank you, George. I was about to cover that one. You're very helpful. I was about to cover that.
He's a good one. Promote him.
Yeah. So, are you okay? George is new. He's a he's a trainee, but he's a very experienced trainee. Trust me.
Yeah.
Would you be happy to have an X-ray and possibly an MRI, depending on what we see?
Yes, one.
Just to help. Also, it gives no offense. It gives George a bit of experience.
Yeah. No. I'm trainee.
Right. I know this is gonna hurt, and it's gonna hurt a lot. But I need you to kind of stand up for us so we don't pick you off the
George.
bed, otherwise you'll float.
I take over, Mike, whenever you get off.
Given how red your skelly system is, I don't think you want to float. George, do you want to take him down in a wheelchair, please?
Yeah, no problem. Where's the wheelchair located?
What you do is do T/carry, and you'll be able to take him down the wheelchair technically.
Oh yes.
Theoretical wheelchair.
Yes, that's
works every time.
It's good that I'm a trainee. This is my first time, so.
And it's lucky we got a very willing patient who's willing to help you.
Exactly. Thank you very much for Being sick.
Yeah, no problem. If you
I was-
don't fix me, then I guess you ain't much of a trainee.
That's true. That's very true.
That's very true. I hadn't thought of it just like that. If you want to put him onto the floor, he can then get onto the bed for you. George, do you know the questions that you have to ask a patient when they have an X-ray in what we do in here?
No.
Okay, I'll help you out with this one because I'm known. Trust me, I'm known for X-rays, and patients. Everyone, all the patients know who come in, know that I tend to try and do X-rays or at least MRIs. Oh, you come off the bed.
Sir, we need you on the bed, please.
Yeah, not the
Oh,
floor.
That floor's very dirty.
Yeah, I'm really trying it.
It's okay. Take your time.
There we go.
There we go.
There we go. If you want to listen to the questions I'm going to ask him, these are standard questions we ask everybody when we have to do an X-ray on them. Are you normally fit and well?
Make sure you don't break your back. Agree on that. Every patient comes here. Yep.
Yeah, normally, yeah.
I'm learning.
Okay. Are you allergic to any medication?
No, not that I'm aware of.
Okay. When was the last time you had something to eat and drink?
Maybe an hour ago.
Okay, that's good to know. Any family history of any illnesses like strokes or anything like that we need to be aware of?
No, not that I know of.
Okay, all good questions, all good to know. How much pain are you in? Now, if 0 is no pain, so basically you can just walk out of here and away you go, and 10 is severe pain, where would you put it?
Kind of in the middle, 5 really. Just mainly the pinky toe for me.
Okay. What you may find is when we heal some of your injuries, depending on what we find, you may find the pain gets worse. Okay, that does tend to happen. Okay,
Okay.
just wanted to warn you on that one. If the pain changes, gets worse, or you start feeling dizzy, sick, anything like that, I want you to let us know straight away because we can hear you in the other room. Okay.
Okay.
By the side of me is George, and I'm Emilia.
Alright, nice to meet you both.
Okay.
To meet you too.
So remember, if you need us, just give us a shout.
Alright.
And please try to stay on the table.
Right, I'm just going to start this X-ray for you. Try and lie still for me. I'll teach you another tip, George. What you can do is when you do an X-ray, and you need an image of what's going on with the patient, what
Yes.
you can do is you can check as long as your colleague's not stood in the way, you can actually check the skelly and use the image that you see on the skelly as a way of diagnosing things.
Ah, yes. Yep.
It's a clever way of doing it.
That is. Yep. And normally, how long does the X-ray take?
It's as long as it can be a couple of minutes.
Yeah.
It
Yeah.
all depends, really.
I suppose more serious injuries like this, so it takes a bit longer.
Let me just go and pick him up on the skelly system again. Technically, I'm not here. To pick him up on the skelly system.
Boys, that's annoying there. Why my scale is messed up like that.
There we go. Let's have a look at this. George, if you want to come over here and have a look at this. You want to come and have a look at this image?
Yeah, yeah.
I've got my skelly open so I can see what's happening and I can tell you what I can see in that. Okay? From what I can see, he's got a severely bruised right leg. Okay? Because it's not dark pink, it's kind of in the middle, so that means it's sort of bruised, so that's badly bruised on the right leg, okay?
Yeah.
Left leg, he's got a break to the bottom of his leg there. If you look carefully, you'll see what I mean. You see what I mean?
Yes, yes.
He's got 2 breaks. He's got a break to his left arm on the wrist, and he's broke his actual right arm now. There's quite a break above the elbow on that one. And he's also got a chest injury, quite a severe chest injury by the looks of it. So possibly cracked ribs and punctured lung there.
This man's very lucky to be alive. I don't know how he is alive.
He needs an MRI really to show up.
I think we have to send him for one.
Mhm.
Right away.
And the severity of the injuries, I'd say. So. It'd be an MRI. I'm requesting an MRI with a dye as well. There's a dye you can use that shows up with all the major organs. So
Yep, just to make sure the flow and everything's blood flow, etc.
Make sure there's blood flow and etc. How are you feeling?
I'm not feeling too bad. Still that pinky toe though.
Yeah, that might be least of your worries, I'm afraid, on that one. With the
Yeah,
injuries
I
we've
just
just
don't
seen
feel
on that,
pain anywhere else.
that could be adrenaline. With what we've just seen on your X-ray, you're actually quite poorly. Actually, strangely enough.
Oh, that's unfortunate. Where am I poorly exactly?
You're literally, your whole body's kind of injured. Which you're probably aware of the fact that it's whole. Did you hear anything that I said to my colleague over there?
Yep,
I'm still standing.
you have a very serious chest injury.
Yeah.
That's
Any bones?
I'm gonna ask you a really stupid question, given how much pain you're probably in. But I'm gonna ask a stupid question. Try and take a deep breath for me. How did that feel?
I mean, I get a bit of chest pain, but not a lot.
Yeah. Right, we need to quickly take you for an MRI just because we need to rule out any bleeds on the brain. I don't think there is any, but we need to rule out any bleeds on the brain, fractures, anything like that. Okay?
Okay.
And then once we've done that, we can give you a clear picture of what we've seen because you've got some quite major injuries there. Okay?
Okay.
Come on, try and stand up for me.
And a 1, 2, 3. Oh, there we go.
I bet that
I'll get the wheelchair.
hurt. Yep, that's a good idea. We need the wheelchair. With the injuries he's got, we need it. I'll go and get the MRI scanner sorted for you. The doors are awkward to get through.
Yep, definitely. I think the hinges need oil.
I have to talk to Cody or Dylan about that one.
Yep, I'll put it in the suggestion box.
Yeah, that might be a good idea. I have recommended new doors before now, but no one listens to me.
Yeah, I think we deserve more funding, to be honest.
We do. Right, okay. That's a good position to have an MRI in. No, you're fine. You're fine in that position. It's okay. There you go. Right, have you had an MRI before?
Yes, I have.
Okay. It's kind of loud. It can be a little bit.
Yeah.
That's
Oh,
right,
this
Mike.
one.
That's right.
Yeah, it could
Fucking awful.
be a little bit claustrophobic, except it is quite loud. Okay, and you just go in and out the machine a few times. What I'm going to do, this is going to sound really weird, but my colleague over there is going to, in the back of your hand, he's going to put some dye in the back of your hand, okay?
Okay.
Now, the dye he's going to put in your hand, don't worry about it. It will not harm you in any way, shape, or form. But what it will do is it will give us a clear picture as to what's going on with you, okay?
Okay.
So he's going to do that. He's over that side. He's going to do that for me, aren't you, George?
Yep, that's right. I'm just doing it here now.
Yep. If you let me know when you've done that.
There you go.
There we go. That might feel a little bit strange. It might feel a bit warm up your hand a little bit with that. Okay. Nothing to worry about. It's just a dye. Okay.
Remember, sir, that just stay perfectly still and we'll
Yep.
just be right through the window watching at all times.
If the pain changes or anything changes, I want you to tell me straight away. Okay.
Okay.
Oh, yes. Yep, I will, Mike, I will.
Started that scan for you.
Doctor, are you expecting this MRI to show up anything?
I'm not 100% certain because he's got on the MRI showing up. Wow, on the Skelly system, it's showing up as there's it could just possibly be bruising, but we just need to have a look just to be 100% that is just the case, that it is just bruising.
Yeah.
It may not. I don't think it's going to show anything else, but it's worth having a look.
It's really not worth a risking. Like maybe the man have a bleed in the brain, internal bleeding. You know what I mean?
I've done quite a few bleeds. I've dealt with a few bleeds on the brain. I've done operations so many times. I've also done operations for pressure in the head and things like that. So it's quite cool. Let's have a look at this image. Yeah, he's got some concussion and bruising now.
Yeah.
See what I mean? He's got some concussion and bruising.
And what's the shadowing around that area? Is that a bleed or?
Yeah, there's a. Wow, yeah, you're clever on that one. I only saw the bruising with that one. That's hidden, that one behind. Yeah, that's quite a bleed there, isn't there?
Yep.
There'll be surgery on that one, and I don't think the patient's going to be too happy, but that's going to be surgery. And if we leave that, there's going to be risk of stroke, everything.
Exactly. I think
Right. Better everyone let the patient know what
yep. I think we have to operate straight away.
How you feeling?
Aye.
How are you feeling? How do you feel?
Hello?
Hello, how do you feel?
Yeah, that's not too bad.
Okay. George, do you want to get some blood drawn up for this gentleman just before we explain what's happening, what needs to happen?
Yeah, no problem. I'll just go round to this side where his hand is.
Yep.
Okay. Sir, if you don't like needles, please look away. There you go.
Thank you. It's just so that if we need to give him any blood during the procedure, we've got it already on system. Right, do you want to explain to the gentleman what's going on, George, what we found?
Yeah. Well, we did. First off, we saw a concussion. That was we were sort of happy with that because a concussion, it's serious, but things could have been a lot worse. And then we saw a lot of shadowing around your stomach area. And when we looked down closer, we actually believe you have a bleed in your stomach. I know, sir, it's a very scary thing, but we really need to operate right away.
Alright. How long will this operation take?
Given that it's me doing operations, it doesn't take long, trust me.
Alright.
But you're at more risk. If we don't do the operation and we leave it, you're at risk of having to come back here, and you may not come back here. You may go to the morgue. It's one of those situations, if you know what I mean.
Yeah, I get what you
George,
mean.
if you go into the cupboard behind you, I do believe there's consent forms for the surgery.
Yeah, no worries.
Mike stocked up on them earlier, I do believe. It's a very small bleed that we've seen, so we're gonna have a look and see what's going on.
Okay, sir. I'm going to hand you over the form, and if you could just have a quick read through it and sign it, and then we'll take you straight through to theatre.
Oh, I need to get my hand on it. There we go. Alright.
If you want to pass the form back to George when you've signed it. I know it wasn't what you were expecting to find. We weren't expecting it. We were like, oh, okay. You know, you've got some concussion and bruising to your head. And then we saw the bleed and we were like, great.
There we go.
Any questions for us that you want to ask us before we take you down to theatre?
No, not really. I just wanna get this done and over with.
Yeah, I know it wasn't something you were probably expecting to have.
No, I thought it's just my pinky toe.
But trust me, you're in the best hands you could be in with me and George. Seriously.
That's right.
If you want to try and stand up for me, just be careful when you do.
There we go.
Right, we're going to take you down to the surgery. I've got the trauma bag, don't worry.
No problem. Doctor, I'll let you lead the way.
Do you believe the other George in ICU has been cleaning the surgery?
All these doors really need sorted. Sorry, sir. We're just trying to figure out which surgery. Oh, there we go. Sorry, Emilia, I got lost there.
Okay, don't worry. If you want to get the patient to get on the bed, I'm just gonna scrub up.
No problem. Okay, sir. If you can get on the bed, please. Everything I was about to type on there.
How you feeling? How you feeling? How you feeling?
Yeah, I'm feeling fine.
Kind of nervous, I guess. You're having a look at the light over there. Right, George, if you want to put this patient off to sleep for this procedure.
No problem. Okay, sir. We're going to count back from 10.
And George is going to put an injection in your hand and
Yeah.
drop you off to sleep.
So start you count from 10 and I'll put down the injection.
You want me to count?
Yes, please.
Okay. 10, 9, 8, 7, 6, 5, 4,
You'll start getting
3,
sleepy.
2, 1. Ugh.
There we go. He's off to sleep. Right. If you want to do me a favour, George, and check his airway, see if his airway is clear.
Okay. Everything seems clear.
Right. If you want to put a tube down his throat and then connect him to the machine just to help him breathe while we do the procedure that he needs doing.
Okay.
You want to let me know when you've done that?
That's done,
That's,
doctor.
yep, that's fine. Just pop the neck brace on there to help with the head. Surgery, let's get this surgery started.
Doing a bit of surgery here. Bit of role play surgery.
There we go. George, if you want to do his arms and legs for me. George,
What's that, doctor? Sorry.
if you want to put the casts on his arms and legs for me.
Yeah, no problem. That's that done.
Yep. Have you put the braces on his arms and legs?
Yeah, just his arms to do now.
Yep, that's fine if we want to do that, and then we can wake him up slowly then.
That's undone now, doctor.
If you want to wake him up, but take the tube out and wake him up slowly. Put some oxygen. When you take the tube out, if you want to put some oxygen on him, he'll be able to wake up.
There we go. Hello, sir. Sir, take it easy.
Calm your breathing. You've had a tube down your throat. You might find it a little bit hard to talk.
Stats and everything's looking grand, doctor.
You're in a hospital. You've had an operation, okay?
How are you feeling, sir?
Okay.
Are
Okay.
you in any pain?
Yeah, a lot.
God will save you.
Mainly my chest.
Okay.
Okay. Let's see.
Is that oxygen that my colleague's giving you helping?
Yep.
That's good. How's your stomach feeling now?
I'm just feeling a little better.
Yeah, it will be a little bit sore and a little bit uncomfortable for a few days because obviously you've had major surgery to stitch up the wound that we found, okay?
Okay.
Right, have you got some pain relief at home?
Yeah, I got some paracetamol and antibiotics.
Would you like another prescription just in case, sir? As I say, you've just
Yes,
been
please,
through
I'm
serious.
low.
Yeah, because you've just had quite major surgery.
Yep. There you go, sir. That's your prescription.
Alright, thank you.
You can take that to when we let you go. You can take that to a pharmacy, and the pharmacy will sort that prescription out for you.
Yeah, will do.
With that wound, with the stitches.
How are you going on, doctor?
To do is I need to keep an eye on them, and I need you to, if you start to get any signs of an infection, like if you had a temperature, anything like that, I want you to come straight back here, and I want you to come and see us, okay?
Alright.
remember to keep it clean as well, okay?
Okay, yeah.
What I'll
Make
do is
sure it's fine.
let me just
Happy days, Taz. That's brilliant.
There we go.
Yes, ones are nice.
Giving you that. Okay, because I want you to keep an eye on that wound, on that where the stitches are, and I want you to change the dressing. Okay.
Alright.
First couple of days, first couple of days your GP will do it. After that, it's for you to do. Okay.
Alright.
Right. If you want to try and sit up and see how you feel.
Ugh. Come on, baby steps. Come on. There we go. Yeah, my legs are feeling much better.
Any pain anywhere when you're standing?
No, just you know that, just the stomach really.
Yep, that's fine. Have you got anyone who can come pick you up?
At the moment, no, but I might get a taxi.
Yeah, that's fine. Have you got anyone who can sit with you?
Yeah, I got my wife at home.
That's good because you need somebody to sit with you for the first 24 hours because you're on a general anaesthetic. Let me just give you this.
The bin man job. It is, Taz. It's good as well. I enjoy it. Like, the bin man job's
It
good.
tells you what we've done, and it also gives you when to have your painkillers. Okay.
Okay.
Other than that, you're free to go.
Alright, thank you. I'll see myself out. Come on.
We'll walk with you.
Alright.
Scary, call it Harry Carry, cause every time I'm digging Harry Carry, I'm Mary, a motherfucking dictionary. I'm swearing up and down, they can spit this shit's hilarious.
There you go.
Take it easy,
Have
sir.
a good day. Thank you.
Bye bye.